Thank you, Rolf. Well, my voice hasn't changed over the past 2 days, so it's great to know that this is being videoed. This will be an opportunity to see how my voice sounds on a video recorder when there is none. Okay, so I've been asked to say just a few words about Rigor. And what that means is that it implies that my comments need to be directed toward investigators who are seeking to generate new data, to answer a question, to build a study around that question that can address it, and what are the things you should be thinking about that constitute rigor. But first, I just wanted to have a slide that gets us thinking beyond, in addition to what Rolf was saying, since these are independent conversations we're having with you, hopefully related, about evidence and what is it. And let's keep in mind that it is information derived from data that is gathered for a purpose. Information for a purpose. And that purpose can be a hypothesis, it can be a specific aim, but it is not just information out there, it is information to answer a question in order to understand a phenomenon. We don't have to always act on that information. For example, does water exist on a comet? We're not going to act on that information, but it helps us to understand our position in the universe and geology and so forth. But it still would be a scientific question. But we want to make a decision. The decision can be a clinical decision to treat, to assess or not assess patients coming into a clinic, to assess or not assess a population with respect to nutritional status of a particular kind, to treat or not to treat patients with particular regimens or not, or to launch prevention in communities, preventive measures that will improve health and what aspect of health. So we need to make a decision or render a judgment, establish a policy if you're in the government and you want to do something about what you perceive as a public health problem. You need the data to generate the basis for making that decision, or to justify launching a program, continuing a program. You know, programs cost money. And so policies once in place, programs once in place, continue to need data. They continue to have a research need in order to monitor the population that is receiving the program, in order to either improve the program or change it in its content, or stop the program and shift from one program to another, which we often consider in nutrition. When we think about supplementation, we think, well, we would really like to have the diet be better in the populations rather than to have to rely on supplements. In order to do that, the diet has to be better in the population, and there needs to be research that will demonstrate that, document it, and provide it as a basis for making that decision. The question to which we must always find the answer is not should it work, but does it work? And that was a question that was posed in 1961 by Richard Asher in a paper in The Lancet. But I would add, we always have to ask, work at what? There has to be that purpose driving the questions. So, rigor. There's different ways of spelling it. And so for Dr. Dangor over here, we have to add a U in there, or he won't know what the word means. For Dr. Patrick, he's more, global, so he understands both spellings. For physicians, you might think that it means a tremor caused by a chill. When you get a fever and so forth. Well, we're not talking about that form of rigor, or maybe some will think about rigor mortis, and we're not quite there yet either. But a reasonable public definition of rigor is the quality or state of being very exact, careful, strict, precise, doing what you set out to do as carefully, as standardized a way as possible, and using that definition and applying it as a way to generate evidence. Rigor has to be documented. Research studies that don't document what they do, what is done, how well it is carried out, is not science. It is an anecdote. It comes and it goes. We can tell anecdotes, we can be anecdotes in our lives, or we can carry out studies that are anecdotes if they are not purposefully carried out, well documented, and reported. So generating evidence, there's two kinds. I'm only going to stick with these comments with one, the generating of original data, original research. But there can be rigor in systematic reviews, which I think Dr. Webb's going to be talking about. There is also, one can think of rigor in applying evidence. However, rigor is critical to recognize, but it's going, when you start to apply it, you need to bring in elements of thought, insight. One has to understand the data that has been generated in context. Data generated about a nutrition intervention in Nepal is different than Bangladesh, is different than Zambia. And one has to understand what is done and what findings come out within those contexts. Rigor has to be modified by the resources and the practicalities of how to apply information that comes from such studies, the realities of the world. But those come later. In the short run, one has to build the evidence base in a very strict, careful way. And so there has to be a protocol. You have to have a plan of action. You don't cook a recipe without, you don't cook a meal or a good recipe without that recipe being specified. What the ingredients are, what goes into it, when the ingredients are added, how much, at what point in the cooking process. You have to have a template, you have to have a recipe, you have to have a protocol. And that protocol will set forth clear and specific aims, goals, hypotheses to test, quantifiable aims that give you the basis to go forward with designing a study. And that study, once you've got your specific aims, that may be 1 or 2 or 3, it may be to describe the prevalence of a condition in a population, or it may be to test whether an intervention is going to reduce stunting, or it may be observational, of looking for risk factors that are associated with a nutritional condition. And, nutritional anemia, for example. What are the risk factors that can help the government identify groups that are at risk, individuals that are at risk, or people who may be more or less likely to respond to iron? Because you can be anemic because you have thalassemia, you can be anemic because you have iron deficiency, you can be anemic for different reasons, and those will be important to discern. So the study design has to address the specific aims. You have to be thinking about your study subjects. If it's an intervention trial, you need to be thinking about who your groups are in terms of the interventions that they'll get to be tested. Or you may have to be, in an observational study, be thinking about the kinds of people you expect to identify in your study and the prevalence, the proportion of cases and non-cases that you would expect in a case control study out in the population. You have to have a sample size that's going to be adequate to address those questions. It has to be powered, as we say, so that you minimize your chances of being wrong, because we are always dealing with error. We are always dealing with it, and we have to be comfortable with it. We have to quantify it. You have to be able to deal with it and see through it, see through it, and interpret your data, even if there is error in there. And so one builds a study designed to try to minimize the probability of being wrong, but you never get rid of that probability. It's always there. You need to be thinking of a study of sufficient duration. If you're talking about a study that you want to understand the dietary intakes, usual intakes of a population, you will need to do a study more than one time, more than a 24-hour recall in a population at one point in time. You're going to need to study that population or subjects in that population over a more extended period of time in order to develop estimates of usual intake, usually. Do the study where the problem exists. Don't just walk out the door and find a population to do a study in. Rigor involves finding the population that has the problem, has the context, reflects the larger population that you want to address with the information that you're going to generate for that particular purpose. Okay? Choose variables in your study that, to collect that are relevant to the outcome. If you're going to assess prevalence of xerophthalmia, you need an ophthalmologist who's going to look at the eyes. Or you need a questionnaire that's going to address rotondi, night blindness in pregnancy. You need to, if you're going to look at other aspects of nutritional status, you need to have the right measurements that are going to reflect thinness, stunting, obesity, or micronutrient deficiencies, whatever it may be. The kinds of outcomes and exposures, those risk factors, can be qualitative in nature. They can be more behavioral, which are harder to measure but require smaller sample sizes usually, but are observational and have structure to them. They just require a lot of work and a lot of training to get that kind of data. Or they can be quantitative, which comes a little bit easier because they can be measurements, anthropometry. They can be tests of a particular function. They can be interview-based questions about recent morbidity, dietary intake. They can be observed data. You go to a household and observing whether there is feces on the ground in the home area. Observe the kinds of walls on the home. Observe behavior of the mother toward children and so forth. So you have different ways of collecting the data, and they should be tapered to the purpose for which you are out there collecting the data. The study has to be ethical. So you need to treat subjects according to the declarations and the procedures and the rules by which studies have been developed over the years. It needs to be approved, reviewed and approved by an institutional review board that can help the investigator work through the needs to treat subjects properly and to inform them and to make research participation voluntary and so forth. So there are critical parts of a study that we can include as rigor as being also applied to having your study be considered ethical. When you're implementing data collection procedures, they should be standardized. You usually have field workers, and so you want your field workers to be doing the same measurements as much as possible the same way from the first data collection to the last piece of data that are collected for each variable. Those, and I often think of it as the community is out there. If you take a picture, you get a photograph of that community. Well, when you have 40 or 50 field workers doing a study, you want them to be photographers, trained the same way, to hold the camera the same way, so that they get the same kind of picture with the data in the community. Those procedures, as I mentioned before, need to be documented. They're documented in a manual of operations. And usually a manual of operations has several chapters that reflect directly the organization and the content of your protocol. So it's an expansion of your protocol. It is the blueprint by which a study is actually done. It is pretty boring reading, unless you are interested to know what investigators did for a particular study, because you want to understand what they did and understand, therefore, the data, or you want to replicate what they have done. In order to do that, you need to have that manual of operations that clearly specifies what was done at every level of the study, at every level of data collection and data handling. In order to do that, you have to have training procedures in place in order for your workers to be reliable, so that they do collect the data in the same way, so that as much as possible, I, as a field worker, am going to collect the data from day to day the same way. Or I and another fellow field worker, that we are going to collect the data as much as possible the same way from day to day. So we're minimizing the differences that can occur and will occur between workers, within workers, from one day to the next. So in order to do that, you have standardization exercises where there are ways and nicely defined procedures for how to test whether your field workers are collecting data the same way. When you look at their performance independently, for example, and they are told to measure the same subjects a couple of times, you can, in anthropometry, for example, derive very clearly how well they are doing from within worker and from one worker to the next. There are once you've got your workers trained and the study is underway, you're not done. They need to be continually monitored. Data collectors are human beings. They have good days and bad days. And so the training can be done well, but there has to be a quality control process overlaid on that study from the first subject to the last subject in ways that monitor the methods rather than the results. We want to pay attention to methods during the study. Let the results fall out where they will. But during the study, you're paying attention to how well the performance, you're paying attention to the performance of the workers and how well they are adhering to the protocol, to their trained procedures. And retrain as necessary, not based on the kinds of data they're generating, but on the methods that they are applying to carry out the study. One has to pay attention to not only how the data are collected, but how they are assembled, the checking that goes on in the field before the data are transmitted, the procedures transmitting that data to now a server, if it's on cell phones, on tablets, or if you're still on paper, to a data entry center, whether it's on a tablet or on a piece of paper, the principles don't change. That data, once collected, need to move through the system to the database without further alteration. You want to protect the integrity of the data as it was collected by those individuals at the time it was done, and to minimize any further error that can creep in when data are being entered or being assembled otherwise. Finally, when the data are together, you need to have, where's my data analysis? It's in there somewhere. There it is. You need to have a data analysis plan in your protocol that is going to address the aims. You do not go off and say, now I've got my data, forget about the protocol. You have to bring closure to your study to be rigorous. And that means address your specific aims with an analytic plan that is appropriate for the data that was collected that was meant to address the question. It all goes back to the question, to the purpose. And then finally, you have to report it. You have to prepare reports, present it to your colleagues, publish in a peer review journal, get criticized, get feedback, and advance the basis of science through this often difficult approach to building evidence. I think that is my last slide. I shall stop for now. Who's running this place? Oh, there's Dr. Clem. And I will turn it back over to you for now.
Okay, thanks, Keith. I think what we're going to do is go into the next presentation. But first, thank you, Keith. That was a great overview of rigor and of the elements of rigor in research. Rigorous presentation.